Hi, my name is Andrew Chopin, and the name of this article is Physical Therapist Management of Lymphedema Following Treatment for Breast Cancer, a critical review of its effectiveness. What is lymphedema? Lymphedema is when there is a problem or blockage in the lymph system that causes interstitial fluid to accumulate in a particular area, mostly in our extremities, which causes swelling and edema. Lymphedema is known to happen to people that have breast cancer. After a mastectomy to remove the tumor, the lymph vessels in that area either get removed or damaged. The final outcome ends up being lymphedema. For this article, it reviews many different trials that are trying to show if physical therapy helps with lymphedema, more specifically, lymphedema caused from breast cancer. The studies had to meet 4 different requirements for this review. All of the patients had to have been treated for breast cancer. Patients had secondary lymphedema in at least one upper extremity. Conservative, non-invasive treatment for lymphedema was the independent variable, and the dependent variable was the size of the extremity being treated. This review used Sackett's rules to determine how credible the trial was. Level 1 is a large, randomized controlled trial. Level 2 is a small, randomized controlled trial. Level 3 is a non-randomized, concurrent cohort comparison. Level 4 is non-randomized, historical cohort comparison. And Level 5 is a trial without a control group. Sackett also had grades of recommendations. Grade A recommendation is supported by 1 or more Level 1 studies. Grade B recommendation is supported by 1 or more Level 2 studies, and Grade C recommendation is supported by Level 3 through 5 studies. For this article, it started with 42 different articles about lymphedema. Out of the 42 articles, only 19 were considered experimental studies. Then only 13 articles were included into this review. The other 6 articles were about lymphedema that was caused by means other than breast cancer. These 6 articles were excluded from this review. And for the studies, there was only 1 study that was classified as a Level 2, 5 studies were classified as Level 3, and 7 studies were classified as Level 5. Only 1 study was considered repeatable, while all of the other studies did not describe the interventions, thus making them unrepeatable. The studies used many different interventions, including compression garments, pneumatic pumps, massage including Foley massage, electrical stim, microwave heating, elevation, and exercise. Out of the 13 studies, 5 of them used water displacement to measure the edema and changes in the swelling after the interventions. The water displacement method is considered the most accurate way to measure edema. The other 8 studies used circumferential measurements. And here are a couple different tables just showing the different levels of each study, the different subjects, and also the length of study, which shows that it goes from a 48-hour trial all the way up to a 12-month trial. So there is different variations in the length of the studies. And this table also just shows a little bit more about each of the studies, showing if it can be replicated, any of the blind assessment, which actually none of them were blind assessed, and the different grades of recommendations. The only grade B recommendation that comes from the level 2 study is that compression garments do reduce the size of the edema after 6 months, and that E-stim does not show any improved results. Grade C recommendations are that elevation alone is not effective, microwave treatment with compression garments show good results in reducing edema, pneumatic pumps and E-stim in combination with compression garments do not show added benefit, complex physical therapy, which includes compression garments, exercise, and Foley massage, do show good results in reducing the swelling. And the results. Many of these recommendations show good results in reducing lymphedema, but it must also be considered that only one of the studies were randomized, and a few did not even have a control group. More randomized controlled studies must be performed to really show what kind of benefit these interventions cause. It must also be noted that the measurements must also be from the water displacement method, and that there should be also a blind assessors that collect the data to keep the study reliable. And thank you.